Welcome, everybody, to the New AI Project podcast. My name is Graham Wolf. I'm a senior at the University of Notre Dame and the program director of the New AI Project. Today, we're excited to welcome Kevin O'Brien. He's a board member at Lirio, MOPD, and Memorial MRI. And for years, he led a healthcare investment practice in the private equity world. And of course, he's also a Notre Dame graduate. We're excited to have him on today and to have a wide reaching conversation about how this world of ideas and startups and specifically healthcare technology is adapting to this new variable of AI. Kevin, is there anything that you want to add to that intro?
No, Graham, that's
Of course, yeah. So on the new AI project side, we've done some really great work over the past 3 years of developing a team of what we call student experts, each writing in their own domain of expertise in this new world of generative AI. So we have Tech Titans, AI at Work, Taming AI, AI in Life, and Research Revelations. So we really, span the whole generative revolution, and there's something for everybody. So we encourage our listeners to go check us out on LinkedIn and Substack after this podcast. Joining us from that team today is Aidan Gilroy. I'll pass it over to you, Aidan, for your introduction.
Yeah, thanks, Graham. Yeah, my name is Aiden Gilroy. I'm a junior here at Notre Dame studying political science and philosophy. And for the last 2 years, I've been lead writer of the New AI Project's Tech Titans column, in which I cover the main strategies and new releases from the major five AI players, looking at OpenAI, Gemini, Grok, and the rest of the many AI. So happy to be on here.
Thanks, Aidan. Yeah, so just to kind of jump right into the conversation today, we've read, and ourselves written quite a lot about the promise of agentic AI. You actually gave a great talk here at Notre Dame a few weeks ago, emphasizing its merits. And for those maybe who are unfamiliar or perhaps not convinced about agentic AI, Kevin, could you give us sort of a recap of why you think it might be, the next big transformative thing, specifically in your world of, ideas generally, but also, healthcare technology?
sure. Yeah, happy to do that, Graham. So, if you step back, right, I think we're all fairly familiar these days. Aiden, you touched on some of the names out there with generative AI, particularly in the form of large language models, right? We've all played with the prompts and used it. They're fabulous tools, right? But just in terms of how they are built, their architecture, right? They are specifically built to generate text, imaging, etc. Right? So you put in a prompt. It's a fabulous tool for really scraping the entire internet and giving you answers. Contrast that to agentic AI, which may utilize large language models in some cases, right? But it's a really different architecture, right? These are AI systems built to be autonomous, to be goal driven. They can act independently to perform complex multi step tasks, which LLMs, if anyone's ever used one, clearly do not do. So they're just different tools for different things, is the way I described them. Not one is not better than the other. They're just distinctive architectures. You take it a level down, maybe, and let's think about, right, so that what is the core purpose of each generative AI, like we talked about, is really generating content based on specific prompts. We're all, again, familiar with that, I think, in our everyday lives. Agentic AI really executes multi-step tasks autonomously to achieve a goal. And so that's one of the core differences of agentic AI is it is able to pursue a goal. You can give it a task and it can, built right, go after that kind of goal. In terms of task complexity, right? Agentic AI can handle complex chain tasks like research, analysis, reporting, whereas, again, we've all used it, generative AI, large language models, really best for discrete single tasks. They're not really built for these multi step sort of tasks, if that provides a little bit of a foundation.
Yeah, I think that's really helpful. And again, moving from the simple sort of prompt and response back and forth into something that you said is sort of chained along and begins, of course, with a prompt or begins with some kind of human input, but then is uh, given over to the hands of a much more equipped artificial intelligence system. I think that does represent kind of a fundamental change in what we're seeing in this ongoing revolution. I'm curious, Aiden, in your work kind of doing research on the tech titan side, first of all, did anything that Kevin say sort of surprise you? But beyond that, how do you think these big tech companies are kind of pitching agentic AI to us or selling this next generation of agentic AI to its consumers?
Yeah, I think Kevin hit it spot on. When you look at the difference between generative AI, it's really attuned to those specific prompts. You ask it a prompt, say generate an image or do research on this one thing, and it'll do it for you. I think the big difference between agentic AI is that it can really think on the fly. I mean, to the best that AI can think, it's not really thinking, but it can adapt to difficult questions. I think the big example when agentic AI started coming out was, say, ordering a pizza. Before, you'd have to maybe ask at each individual step of, okay, I want this on my pizza, then it would respond with another prompt. Now you can just say, order me a pizza, I guess in theory, and it'll go through and it'll actually make the call. It will place the order. It will pull from your credit card information. It will then say the credit card information over the phone, and then it'll put in your address and it'll bring it to your house. That's kind of the multi-step idea behind agentic AI. And so, yeah, I think that has the potential to do a lot because it can, like humans, do multi-step capabilities and proceed along solving a problem that may have taken more steps than a user had inputted originally. So I think that's the bigger difference.
I like the pizza analogy. I think I remember you brought that up to me. I think that's, yeah, it's very intuitive. But let's talk about healthcare. So given your background working with companies sort of at the intersection of AI and healthcare, what do you see as like the big applications of agentic AI to healthcare? And just more broadly, how is the healthcare technology world adapting to this variable of AI?
Yeah, so it's agentic AI in particular is starting to penetrate healthcare. In the talk I mentioned, there was a study, I'm blanking on who put it out there, but it was Gartner, right, saying that less than 1% of enterprise software applications included agentic AI in 2024. That's predicted to be 33% by 2028. So you can see it's coming,
Oh,
right? The kinds of things you would see agentic AI taking on administrative tasks. So you think about the world of providers, anyone who is, this is doctors, hospitals, and anything that is a bricks and mortar kind of healthcare place you go get healthcare services. And then the world of payers, insurance companies. People are familiar with insurance. There is this, constant sort of tug of war administrative burden resident within our healthcare system where, okay, you show up to the doctor, what's your insurance? Someone has to query and say, okay, are you covered based on the provider you're using, the nature of the services? That is a complex task that humans undertake today. That's a simple one I think for people to picture. If you had an agentic AI system that could query, could run with this workflow. Think about agentic AI as tackling workflows as opposed to specific prompts that generate text, right? Again, in this distinction we're trying to create, you could have an agent, and these are being built, an agentic AI system that would say, okay, Aiden, you show up at the doctor's office, you provide your insurance card to pick on you for a minute, right? Instead of a person in the office either going online and querying the insurance and looking up, okay, where does this all fall, or getting on the phone and actually calling the insurance company. That's the way it used to work, and in some cases works today when it's a little bit complex. If you had an agentic AI system that could sit there and say, okay, again, picking on you, Aiden, you've gone to Dr. X. They're either in or out of network. They're wanting to, you're needing this kind of services, and it's captured like a lot of things in healthcare and what's called a CPT code. You could actually have an agentic AI system then query the insurance world, right? It could think about all the insurance providers, including state and federal government, and say, okay, based on Aiden's card and the actual plan, because no one insurance company has a single plan, there's multiple plans. It's incredibly complex, as you could picture, and then Agentic AI system could then sort of match and say, okay, based on the doctor, the nature of the services, I'm going to then go out, figure out what insurance company, drill into the plan, and say covered, not covered, and on the spot, the person you're in theory interacting with, Aiden, would say, okay, Aiden, you're covered. Here's your deductible. Here's your copay, whatever, and you've got it right there instantaneously. One of the things that there's different estimates out there, but if you think about it, something like 20 to 30% of healthcare costs in the US are attributable to administrative workflows. You think, and we spend something like $5 trillion as a country. You start to take a whack at that, then there's a lot more. One, you're saving money for the system. Two, you could take some of that money saved and repurpose it, for instance, for underserved populations, you name it. There's lots of interesting things you could do there. So I'll stop there, but I think that's one decent example.
Yeah, you mentioned the idea that I guess in current practice, because agentic AI isn't as integrated right now into healthcare systems, though, like you said, it could very well and very might be in the next 3 years. Um, it seems like it's the process right now is very complicated, and that's just because right now you have humans in the loop, humans that either make mistakes or don't have all the answers at their fingertips, like agentic AI
Well,
does, or
yeah,
is more likely to have.
yes.
Do you
And
do you first?
it's highly regulated, right? We
Yeah.
have the stuff called PHI. So, a person's healthcare information must be protected. So it is hard
Yeah.
to move data and manage data within healthcare just because it's a heavily regulated industry, as it should be.
Yeah. No, you have HIPAA regulations and all these different personal privacy regulations. Do you foresee like those regulations being uh in some sense the first to go, because I feel like in some sense they would have to go if you want to have this agentic AI interface in which I can go in with my insurance card and it knows me and it knows which doctors that I've been to in the previous last 3 years, and it knows whether or not they're in system or out of system. It would have to at least know and recognize my personal data. So is that what has to happen in order for AI integration to enter into healthcare? Do you foresee another way, or is that really the only way of it happening?
Yeah, I actually don't see that happening, right? I don't see
Okay.
regular. I think actually we may go the other way, which is like all things in technology. I think rules and regulations tend to lag innovation, right? So I could see actually standards being raised over time. I work with a healthcare agentic AI company. There are things, certifications you can go out there and get SOC 2 high trust to say that there is incredible integrity and security to your fundamental IT systems. That's part of, I think, the things that agentic AI companies will need to do, kind of table stakes, right? And then whenever you're using data, there's these agreements called BAAs, right? They're pretty common in not just in healthcare, but in the entire technology industry, which business associates agreement, it helps, it allows company X to utilize company Y's data, right? So my company onboards data, including, HIPAA, information from its customers, in that BAA. My company takes responsibility for that and is liable should that there ever be a breach of that information, et cetera. So no, I don't. I think that is something it's going to evolve. It's going to lag because that's just the way I think regulations tend to go, or policies, or just best in class standards, right? That emerge. That's going to come, and I think it's important for that to come. It's important for agentic AI companies to paint within the lines, if you will, in terms of, if agentic AI is going to penetrate healthcare, it's going to need to do it compliantly and safely. And that's something that these companies, as they emerge, are going to need to prove to their customers, and in turn, the users in the healthcare system, like all of us and everyone else out there, that they are safe, and that when you interact with one of those systems, your information is just as safe, ideally safer, than it would be in today's world where these systems aren't sitting in the middle of some of these workflows.
Yeah, I think that makes a lot of sense. Again, one of the major barriers to entry, I think, in across sectors that we've been exploring across our different researches is trust in this new variable of artificial intelligence. I mean, with the transition into the information age 20 years ago, that kind of inherent trust in a lot of institutions was already being eroded just by the introduction of technology. Now, of course, just as soon as people had maybe started to get used to that new standard of and as soon as compliance and regulatory standards had caught up to that transition, now we have started this transition into the intelligence age, where even more perhaps invasive or more targeted specialized technologies are being introduced to sensitive spaces like in healthcare. So I think that trust is a really important barrier to entry, which we've begun to touch on here. But I think just to kind of zoom out a little bit and look at healthcare historically, it's been kind of one of the more lagged or perhaps like technology on the back end of the adoption curve for lots of technologies, slower uptake, you could say. And I'm curious just generally why that might be. But then, of course, do you see that also being the case for artificial intelligence? Is the healthcare world, going to kind of follow that historic pattern and end up on the back end of that adoption curve? Or might we see a reversal of that trend as we move into the intelligence age?
Yeah, that's an interesting question. So a couple things in there. One, will healthcare lag? Yeah, I think it will. I used to, at my old private equity firm, would be talking about a healthcare company, and I had other partners that focused on other industry sectors, and I would, oftentimes say, time out. Remember, healthcare is roughly 10 years behind your industry, consumer, industrial, whatever, in terms of the adoption of technology, maybe certain management practices, et cetera. You asked in there, Graham, why that is the case. One, we hit on already, which is heavily regulated industry. Two, one of the things I used to always look at with my companies when we're thinking about innovation or driving efficiency is changing practitioner behavior, physicians, nurses, et cetera, right? They have a way they do things. They have been trained to do things safe, appropriately, safely, to do them in a very specific kind of way. Changing that behavior is always difficult, right? There is you got to overcome that trust barrier with the provider community before you even think about the patient community in terms of adoption of new practices, technology, you name it. And so that's part of it as well. And then finally, you said, could we see that trend maybe flip? I do think we could, and part of it is because we as a country are spending over $5 trillion. You've got tremendous strain on the federal government who administers the Medicare program, the states that administer Medicaid programs that really tend to go to people with greater needs. Right? There's just because of the nature of the industry, like we said, highly regulated, a lot of administrative burden, it's pretty ripe for the picking, right? Given the nature of it, and so I do think we could start to see some that trend reversing. Now, many of the solutions will need to be very purpose built for healthcare, given the nature of the industry. It's not like the consumer industry or anything that we're kind of used to. The rules are much more prevalent. You got to work through those. Obviously, a person's health, the stakes are inherently higher. It's not, oh, gee, I picked the wrong thing to stream today. I'm going to be fine if that happens, right? Or my streaming service recommends something silly for me, right? Life goes on. That's fine. If agentic AI or any form of AI is involved in pick it, patient diagnosis, things like clinical trials. There's a lot of what's called clinical decision support tools that aid those providers in the room with the patient on what's next. And when you look at, someone comes in and presents with certain symptoms, there are systems that will help those physicians or nurses not override them, but help them determine, okay, gee, I show up at the doctor's office, I have a series of kind of issues or complaints. There are systems that will help that physician or nurse say, okay, based on this, you might think about a test for X or Y or Z or imaging to look at this issue over here, right? That's out there today, but you got to be, careful with that. But again, I think there's a lot of opportunity. We have a shortage, right, of physicians, of nurses in this country. How do you help those people work at what we like to call it the industry, work at the top of their license, right? So not be burdened with tasks that other people could be doing or administrative tasks. How do we help them execute at the highest possible level? Some of these systems can really help to do that and allow those people to really take care of more people, quite simply, which is good for everybody.
That makes a lot of sense. There are, many different ways that we can apply AI to the medical field. Many of which will save people time and save, practitioners time, clinicians time, administrators time, patients perhaps. And whether it's clinical decision support tools, admin efficiency, diagnostics, transcription, et cetera, there's, I think, just a lot of time and money to be saved. You talked about all these pain points sort of on the front end, a strain on government agencies, federal and state, over $5 trillion in spending. And, it's sort of no doubt that there's a big scale of inefficiencies to be addressed within the healthcare space. Certainly, there's lots of opportunity within AI and agentic AI, but I'm curious, how do we as society or as a concerned subgroup of society ensure that these efficiency tools actually create efficiencies that are then passed on to the right things, passed on to the right people, whether it's into lower spending, lower costs for patients, or better patient outcomes, or better work lives for practitioners. How can
Yeah.
we kind of direct that and align the efficiencies of AI with the challenges that we currently face?
Yeah. So as I think about that, it's going to be a process. We really are fundamentally talking about for-profit organizations trying to build tools that make the differences you just articulated, right? So number one is this is a capitalistic society, right? So if you build a solution that creates poor trust, is leaky with data, isn't really driving outcomes, which is the essential, I think, element everyone needs to focus on, those companies will be left behind, right? And so, in my mind, what will occur is there will be and there are many companies tackling these different sort of opportunities or problems in healthcare. Best in class solutions, best in class companies will emerge, and they will emerge because they're doing the right things. They're producing outcomes, they're keeping data safe, and the promise, whatever their value proposition is to the customer, be it an insurance company, a physician office, a health system, you name it, there is delivery behind the promise, right? That the value proposition is coming through. Those are the companies that inherently will not just survive but thrive. People who aren't doing it right will get left behind. That's a dimension of it. And again, I do think from a standards or regulatory standpoint, that will inevitably lag. But at some point, that will catch up, probably actually be formed in my mind as best in class answers get evolve in the market. It's likely that standards or regulations will say, okay, if they can do it, everyone else should too. And so this is the bar we're gonna set if you want to whatever, participate in clinical decision support for imaging, for instance, or you want to participate in that insurance space we talked about, more administrative. But again, you get that wrong, and going back to Aiden, if we tell Aiden, you owe $20 for today's visit, and he gets $1,000 bill, it's going to be pretty unhappy, right? And so these things will emerge, I think, over time.
Gotcha. Yeah. Sounds like there's kind of a trust the process mindset that goes along with kind of trying things out, and trusting in the right companies to come up with the right answers, and then regulators to kind of swoop in and fill in the gaps maybe.
Yeah, I mean, when you think about it, right, we're the small company I work with, we work with insurance companies, health systems, physician groups, right? To get to yes with one of those organizations, you are being put through, it's their reputation. Our reputation as a company, the company I work with, it's our reputation, but boy, it's really their reputation, right? They have thousands or in some cases millions of people they serve. When they adopt a technology, it's their name on the line. And so believe me, we get put through a lot of tests, whether it's the IT people, whether it's data integrity, you name it. Because the stakes are higher in healthcare, I do think there's maybe another dimension that I didn't touch on that I should have, which is the customers, because the three of us aren't buying agentic AI systems. It's the healthcare organizations out there that are buying them. They have a pretty high bar because they do something wrong, they themselves could get into regulatory issues, they could lose their customers. And so that's a filter, let's call it, that these innovative companies need to be appropriately put through before they themselves are interacting with humans regarding their healthcare.
Yeah, that sounds like a pretty good accountability mechanism or filter, like you say. Aiden, I'll pass it back to you. Anything surprise or interest you there about what Kevin said?
Yeah, I think just going back a couple questions, we were talking about you touched a little bit on patient diagnosis, and I think this is
Mhm.
a really big area in which AI has a huge potential to be very powerful and very rewarding for the population. We see this already with image screening, in which AI can very easily diagnose a problem with a high degree of accuracy that
Yeah.
radiologists may have missed. Again, with the administration woes that we kind of currently see and large wait times with an AI, you can cut down those wait times and save a huge profit that can be used for altruistic means, which could really benefit society. But with these huge increases of efficiency, you also see this big fear from the public, and this fear has been around since 2023 when AI first hit the market, which is a loss of jobs. People are
Mhm.
very worried about losing their jobs. And what I found most interesting is you brought up this idea as the goal of AI, at least as we see it now, and with your companies, it seems, is to help providers work to the best of their license, to the top of their license. And so, I guess, do you foresee any fields of healthcare or that are just going to be completely cut off by AI, or do you think in general it's really just going to come alongside and help people be better at their job?
Yeah, so I guess a couple things in there. So as to the fundamental question of, will AI eliminate certain jobs? I think the answer is inevitably yes, right? But they probably will be more, let's call it menial tasks, lower skilled labor, or skilled but in a very narrow domain. Like insurance is this arcane sort of thing, right? That we all have to navigate. And the example I gave about checking your insurance, are you covered, not covered, what all this sort of thing, right? That's an obvious area where you don't need a call center with people kind of looking things up, right, over time. That could go away, right? But at the same time, when I think about agentic AI, right, we're talking about um, companies' solutions that are really affecting workflows. Could be diagnosis, as you said, Aiden. That in and of itself is going to create another set of jobs, right? Because that one, these companies that heretofore didn't exist will exist. There's going to be jobs there. Those jobs, when we talk about, if I can digress into this, when we talk about agentic AI, well, I don't know. Whenever we think about AI, we think about somebody's like coding, right? You're sitting there and you're writing the code for this, system, and certainly you need those people, right? But when you think about agentic AI, we're talking about impacting workflow. We're talking about complex multi-step tasks, as we touched on earlier. That's going to take another dimension of expertise. How does insurance really work? Coders probably don't know that. So you're going to need people with insurance expertise. In our insurance example, if we're thinking about imaging and diagnosis, right, that's the domain of a group of physicians called, right, radiologists. They read x-rays, CTs, MRIs, et cetera. You're going to need people with expertise in that domain. You're going to need people, within healthcare. You're going to need people that just understand workflows, right? And so, how does, like, we're trying to get this agentic AI system to examine data set A, make a determination, then do this next step, then do this next step, right? You need people that understand workflows. And then going back to your sort of earlier question, I think, Graham, does it work? Is the promise of whatever this company is suggesting, is it real? You're going to need people with expertise in kind of pre and post implementation analytics, right? Are you making a difference when you look at population health calculations, or dynamics, right? Are you having a population health impact? That's a whole other skill set. So while I think some jobs inevitably will be subsumed by the capabilities of agentic AI systems, there's going to be a whole nother category, I think, of jobs created, not just at the companies that build these systems, but at the customers, right? Again, thinking about my little company I work with, we're starting to see job creation at health systems, at insurance companies, people who have have reasonably deep knowledge of not just AI, but maybe a little bit later there. Most of the heavy AI people are going to be in AI companies, but people who are looking at, there's this concept of the digital front door, right? How does a healthcare organization have a digital front door? We're used to a digital first experience in so many other aspects of our life. How you need people with that expertise. So I think I don't know how it's going to balance out, but I think it's going to lean in the direction of, I think, higher skilled workers, people who have the ability to think critically, to think in an agile kind of way about how do we solve solutions, or how do we solve problems where there is a new solution set, but how do we do that safely and effectively? That's going to create a whole other set of jobs as well.
Awesome.
Yeah, I think that makes a lot of sense. And I think that in more fields than just healthcare is the way that we're going. I think you are going to see a lot of these menial jobs that first and foremost people don't like to do, especially administrative tasks, be kind of put aside into the AI bucket, which then will allow people to think more critically and to do things with higher degree of accuracy, a higher degree of efficiency, which, as it relates to healthcare, will increase patient engagement, will increase patient enjoyment, and obviously patient outcomes, which is what we want to see. So,
Yeah, but we also have to be careful, right? When we talked a few weeks ago or last month, right? Another dimension of this, right? Is you put all these tools in the hands of people who work at, pick it, an insurance company, a health system. Suddenly, it's so much easier to send messages out to people, and I can use generative AI to create and blow out, right, a higher volume of message traffic to the people we serve. You got to be careful with that too, right? All of us have gotten, text on our phone and you type stop, right? It's too much, right? I'm getting all this information. So I think, a not today problem, but a coming problem will be, as this solution set evolves, how do you really target, right? What we're going to go after? How do you not saturate the healthcare consumer with too much information? Because there's a risk there where people just check out. They're like, I can't take all this. I'm getting messages, some cases conflicting messages. I should do X, I should do Y next. I'm confused. I'm just going to do nothing and call my doctor, right? You could see that happening. And so we got to be careful with that as well.
Yeah, that's a really important subject. I'm glad we were able to touch on it. I think it's important across again all domains, not just healthcare. But I think what's emerging out of this conversation, Kevin and Aiden, I think is the idea of trust and how it's sort of this facilitator of execution and deployment and uptake of these new applications of AI. So I think you've done some really great work on understanding how AI companies are targeting trust and trying to cultivate it in their users. Could you maybe reflect a little bit back on some of that work, particularly with Anthropic? I think you did a really great job deep diving on that a few weeks ago, again, up on our page on LinkedIn. Yeah, again, just sort of reflect on that through line of trust as it pertains to the rest of the AI world.
yeah, definitely. Thanks, Graham. Yeah, I think when I was looking into Anthropic, with if you don't know what Anthropic is an AI company that has been around since about the origins of OpenAI, and the whole point behind Anthropic is safety. They've seen AI and its ability to interact with individuals, and they've seen AI and its potential to do many great things in the world, the potential of healthcare implications, as we've been talking about in this conversation, as well as many more. But what they don't want is misaligned AI. They don't want AI that is going to take people's data and produce really bad ends that individuals might not want, or AI that's going to maybe incentivize human beings to go down roads that are really bad. And so what they've done is they've increased their safety measures. They have about five or six different measures that they have before they release an AI model to the public. Models such as open sourcing their AI code, in which many different people can audit it and look at it and double check to make sure that it's aligned with their ideas and aligned with their incentives. They also have individual chat monitoring, in which if they can see that an individual's chat with Anthropic's technology is going down a wrong path, or going down a path that might lead to the creation of, say, a technology or a specific invention that somebody's trying to create that is not good, they can cut it off there and stop the chat there. And so I think when you look at this in a general idea, you see these companies such as Anthropic trying to create AI that is working with the human beings to best benefit the human beings and their own individual desires. And this is maybe opposed to an AI that is really just trying to take as much as they can from human beings, whether that be data, whether that be their time, whether that be their attention. And I think this is really going to be the dichotomy. You're going to have AIs that are really just about money, that are about taking as much money, using the product that they're creating to really hurt human beings. And you're going to have AI companies that are trying to best benefit human beings and come alongside them in their own endeavors and in their creative potential. And I think that is really what's going to be the question of the future. Which one is going to win out?
Yeah.
But I think you do see this really big dichotomy in the world of AI right now, and it's been interesting to follow.
Yeah, so I think people would ideally like healthcare applications of AI to be firmly in that second camp, where things are, just perfectly aligned with humans' desires in the long term, not just these short term attention or time or money outcomes. Kevin, how do you see the behind the scenes work of developing an AI tool or deploying it to a health
Mhm.
system? How do you see the behind the scenes working such that we're keeping in mind those AI alignment goals in the long term?
Yeah. So I guess the good news about healthcare is there, set AI aside, there is an entire field within healthcare of assessing population health, right? And within population health, we've got what's called the social determinants of health. You think about age, ethnicity, level of affluence, level of education, the kind of insurance you have, right? And people have studied this. There's a lot of research out there about, again, setting AI aside, other innovations in healthcare could be the advent of more advanced imaging. Is it good or bad? How does it affect the population? So the great news is there is an existing framework out there. And when we think about the emergence of AI will be put through that same rigorous framework of, is it actually making a difference? Is, you go back to social determinants of health, is an AI tool skewed, right? We talk about hallucinations or bias, right, within AI. There are existing frameworks within healthcare. There are incredibly skilled, incredibly smart people who can assess this. And as you allow, right, an AI tool out there in the world, right, that's a little bit of the trick. A trick is, or challenge is, unlike a large language model, which you can train in the lab on data and say, okay, if I put prompt X in, does the output of Y make sense? Is it rational? Is it silly? Does it, is it hitting the target, if you will? One of the challenges with agentic AI, or just healthcare AI in general, is it's a little hard to test it in the lab until you let it out in the world and it starts to do what it's supposed to do. It could be an administrative task, could be a diagnostic task, could be interacting with human beings and encouraging them to take that next best step in their healthcare journey. There is some risk where you don't know what's going to happen until you sort of let it out in the world. And that, so that's on the one hand not great. On the other hand, there is a framework in place to say pretty rapidly, is it doing what we think it was going to do, or is it having unintended consequences? And again, in that sort of, think about that social determinants of health framework, you tend to see that the more educated, affluent people with better insurance tend to have better healthcare outcomes. Not shocking, right? So you could quickly say, if we're launching a tool out there, is it bringing the population along in kind of a good homogenous way, or are there segments of a population being left behind, which suggests that there's a gap in the architecture, there is a bias inherent in what you're unleashing on the world? Then you would, quickly probably want to reel that back and retool it and say, okay, how do we continue to work on this solution so that it is more all encompassing, that we chase out any biases that may be not intentionally but accidentally resident within our solution? I think there's a way to test it. And again, there are very high stakes, right? When you think about these AI solutions in healthcare, they're pretty much white label solutions. So the customer probably doesn't know, the patient, the member of the insurance plan doesn't know, in a lot of cases, they are interacting with an AI tool. So that means the stakes for the customer, the insurance company, the health system, you name it, are, like we said earlier, very, very high. And so they, again, the company I work with, that's one of the things we work on very hard, is within the first 90 days of launching what we call an intervention, a use case, right? We are assessing that. We're sharing that data with the company. We're collaborating with the health system, the insurance company, you name it, and saying, okay, are the results we're seeing the results we want to see? And if there are gaps, what do we want to do to kind of massage the outcomes, maybe tweak the architecture of the tool to drive the outcomes we all intended? So there's a feedback loop, in essence, is what I'm saying. It's a pretty tight feedback loop, I think, in healthcare. So is there risk? Yes. But I do think that there is a relatively rapid assessment framework out there where you can say, okay, are we doing what we think we're doing, or yeah, are there some unintended consequences here that suggest that this tool isn't, the promise of this tool, this company, this solution isn't quite what we thought it was going to be?
Yeah, I think that's a really pragmatic answer. I think when we talk in other to other experts in other fields about AI alignment, there's a lot of sort of talk of ideological alignment or these very nebulous or amorphous kind of ideas of alignment. But I feel like healthcare might be, uniquely positioned to ground that kind of alignment question within the specialties that already exist, pre and post deployment analytics, the determinants of health, that kind of thing, in a lot more black and white way than, a lot of other industries, which is interesting and reassuring in a lot of ways. I think that stems from, again, the two drivers that we've been talking about this entire time, which are number one, the high stakes involved with healthcare, and number two, this ultimate focus on health outcomes as the final push of this entire system. So yeah, again, like I said, pragmatic and certainly reassuring. But just to keep us honest on time, I think we're gonna start to wrap things up here with a few parting thoughts.
Yeah.
The new AI project as an organization, we're fundamentally a pretty optimistic group. So I think we often like to end by looking to the future and sort of talking about what some of the merits of this ongoing revolution might be for the future. But then also fundamentally we're a student organization, so we like to think from that mindset and think about what we can do ourselves as students to prepare for the future. So I'll pass it over to Aiden again for some parting thoughts on brand with our mission.
Yeah, I think as it relates to the student question, we've got a lot of students here at Notre Dame who want to study healthcare, who want to go into the field of either surgery or nursing or some type of research. And so, as we've talked about today, it seems like AI is going to be with them into that field and, in some sense, either partnering with them or in some fields removing their jobs. So, I guess as it relates to students, what advice would you give students that are desiring to enter into the healthcare field? How should they utilize their time to best prepare themselves for the future? And how can they start learning about AI now to help benefit them?
Yeah, so a fair amount in there. Let's unpack it. So start at the end there. What can you do to prepare? As we talked about earlier, right? I think that one, these solutions are emerging at a ridiculous rate, right? So you can't just say, if you do A, B, and C, you're in great shape, right? In my mind, you got to think more broadly. And as I think about it, right, of course, you're going to need the coding folks, let's call it, right? So people who have deep expertise in kind of in fundamental technology, hard skills there. But as we talked about earlier, understanding workflows, having domain expertise, understanding analytics. So in my mind, you know, if I had a child who was at school right now who wanted to do what you just talked about, Aiden, my advice would be, just learn to be a critical thinker. I think these companies are going to, obviously need a wide range of skills, but fundamentally, like serious intellectual curiosity, an agile mind, being able to think about new problems where there aren't sort of rote answers, and think critically about not just what we're doing, but the downstream, as we've talked about here today a bit. What are the implications? What are the unintended consequences? Right? That is, it's an emerging field. And so I think creative thinkers, really curious people, people who can think beyond the problem we're solving today and thinking about what is the next iterations of that as we do X, what will happen, why, we could have a variety of outcomes coming out of that. you know, how do we really assess things holistically, right? And I think Notre Dame and just its approach to education, thinking about things holistically, not just the problem at hand, but the broader implications of that problems. Those are pretty fundamental skills that these companies are going to need, I think, to be successful. So I don't have, take this certain course with this certain I don't have an answer like that. I would really encourage people to, study broadly, have a really multidisciplinary brain, right, that can think about really problems that don't have answers today, where there's an emerging toolkit, if you will. And you really got to be careful about, as we talked about here today, how those tools get deployed. How do you assess whether they're doing what they're supposed to be doing? These are the things that go through my mind. So it's not a prescriptive answer. I don't think I'm bailing out, but think broadly, be curious, and just be open to tackling new problems. And in my mind, as a what do you study matter or how do you prepare yourself matter, I think, yeah, just having a big brain that can go a lot of different places, right? And you're just not sort of narrowly focused in one lane. Agentic AI solutions are inherently interdisciplinary. And I think people who can bring that mentality is just a critical facet of being successful.
Yeah, thank you for that. I think that's right. That's definitely something we try to emulate as an organization here, researching everything across the entire spectrum of AI applications. So yeah, thank you for that. And thanks for your thoughts and opinions and takes and expertise. This entire conversation's been really fascinating. And we'll take a lot of it back with us as we continue to research our socio-technical applications of artificial intelligence. Kevin, thanks so much for being here.
Thanks, Kevin.